to Viewpoint. Today we have the great pleasure of introducing and speaking with the Tuolumne County Health Officer, Dr. Liza Ortiz. She's sitting here with me, and we're going to hopefully expand your knowledge about what the health department does, what their challenges are right now, and how they hope to work with those. My name is Diane Doddridge, and I'll be your host for today. Hello, Dr. Ortiz.
Good morning.
Well, first of all, I think people would be interested to know a little bit about your background, how you come to us, how we are fortunate enough to have you with this broad background in public health.
Sure. So I did my medical degree at Rush, which is in Chicago, and through that time period, I got very involved in community health and underserved healthcare, and developed an interest in public health. And my intention was to get my public health degree at some point after residency. I started a primary care or family medicine residency in Miami, and really found that I wanted to go broader earlier, not just direct patient care, and found out that I could transfer residencies to UC San Diego in preventive medicine and public health and get my public health degree at the same time, which was a lot of work, but it was wonderful. You know, when you really like the work, it sometimes isn't so bad to do a large volume of it. So I transferred to UC San Diego and got my master's in public health and epidemiology, and part of our requirements for our residency at that time were that we did some work in public health departments and had an extensive education in how public health works and what we cover and how local health departments work and how they integrate with other levels of public health, and had a really wonderful time and a great experience, and did a lot of community healthcare work in San Diego, and was always looking for an opportunity to get involved in public health, and decided to come back to California after practicing in Chicago for a few years, and was very lucky that the timing worked out, and here I am.
Here you are in a small, rural situation rather than Chicago, Miami, or San Diego.
Yes.
Quite different.
Yes.
But with your background, I'm sure you are adjusting perfectly. And that leads us to the next question.
Sure.
Not really a question. I think I want to open it up here and have you tell our viewers what you see as some of the, I don't want to say important, because they're all important challenges, but the ones that this particular health department is going to emphasize and put the resources and time into in the future.
Sure. So of course everybody knows that we're in a very significant drought. We've had very large wildfires in the past and very recently. So there's a fair amount of emergency preparedness that the public health department is involved in all the time, whether that's natural disasters or infectious potential disasters that we get involved in. So there's a significant amount of time and effort that we spend on that. One of those types of things is actually the health fair coming up October 20th and 21st.
You mentioned that.
It serves as sort of a mass vaccination drill for us as well, because we do give out a very large number of flu vaccines, which will be available those days. And it's a opportunity to sort of drill our emergency preparedness work, how we run a massive event. So that's some of the work we do that's kind of always ongoing. A lot of people think of public health and think of infections and think of outbreaks. A lot of that stuff is what makes the news, whether it's something as unprecedented as the very large Ebola outbreak. Pertussis is a very big issue in California, and now it's become a national issue. We have small local outbreaks.
Just for a moment. For those who might be watching who don't know what pertussis is, that's whooping cough.
Whooping cough, yes. So pertussis, also known as whooping cough, for which there is a vaccine that people should make sure that they're up to date on. So a lot of people think about the infectious stuff, and we do deal with that all the time, whether it's a local outbreak that we have to deal with immediately, or just in general trying to make sure that our vaccination rates are high enough to be protective. But I actually think that the big elephant in the room is chronic disease. Because most of us are going to die from chronic diseases in this country and in this county. And how does public health address the biggest healthcare problem that we have? Because a lot of what public health does is coordination, or making sure we have access, or I think a lot of what we do is education and outreach. So focusing our efforts on that as we go forward.
Now, when you speak of chronic disease, can you give us 2 or 3 examples?
Yes. So high blood pressure or hypertension, heart disease, whether that's, because you have high cholesterol or have had a heart attack or congestive heart failure, lung diseases like COPD from smoking, or, if you have asthma, that's a chronic condition, and diabetes, which everybody knows a lot about these days.
We do.
Yeah.
We certainly do. There seems to be an epidemic of it.
Indeed.
I also know that there is some emphasis in the county on suicide prevention. Mm-hmm. Could you tell us why?
Well, in the past, analysis of Tuolumne County rates have shown that we've had very elevated levels of suicide compared to other counties of our size. Because we're small variations can seem very large. And there has been a significant improvement, really, because of all the efforts that people have made for suicide prevention. So,
I had not heard that. Also, we are high in other statistics. Could you mention those?
Sure.
And of course, those are relative to our population, but
sure,
nevertheless a problem.
Well, somewhat related to suicide prevention, we have high rates of substance use, whether that's alcohol, tobacco, prescription drugs, or illicit drugs. In general, rural counties suffer from higher rates of alcohol use. We know that 49% of households in Tuolumne County have a tobacco user, which is significantly higher than the California average.
Wonderful. Now can you speak for just a few minutes about what the Public Health Department's role is in these challenges?
Sure. So some of our role is actually figuring out those numbers, assessing our county's health needs and determining where we stand compared to others, determining what are the factors that are most closely associated with whatever data point we're looking at. So you might notice, for example, somebody who is a smoker might be more likely to live in certain neighborhoods or certain types of housing. And so that can help us focus our intervention. So if you know that we have a high rate of household smoking in apartment buildings, then maybe it's more efficient to use our limited money for tobacco control in that area. So that's some of it. Some of it is general education and outreach.
I had never thought of that. Of course, that makes sense.
Yeah. And that's part of what I really love about epidemiology is you can look at a problem and break it down into where you're going to be most effective. So we're currently doing a lot of analysis of our prescription drug use and trying to find where we'll be most effective there. In
use and abuse.
Use and abuse, yes. I mean, because certainly we can have a high rate of use, and if it didn't lead to poor outcomes, well then, okay. If there's no poor outcome, that's fine. But unfortunately we do have outcomes.
This wonderful week-long series of articles in the local paper.
Yes.
About open.
I'm glad that you noticed that. That's what we wanted.
Yes.
So media outreach, public speaking, general education to the public, or certain sectors of the public about issues that are important.
Was this department instrumental in advocating for that sort of outreach? Or was that?
We were heavily involved, yes. It was a collaborative. There's a coalition of medical providers and other departments such as behavioral health and education and law enforcement, and we all got together and we each wrote an op-ed.
Could I ask you a question in line with that, speaking of behavioral health? Mm-hmm. And I know you work closely with those. As a special ed director and teacher for a long time, I also did that. We're going to have a new juvenile facility for our youngsters who break the law, and they're going to be kept here. Will they get behavioral health services? That's kind of out of your purview, but I was curious about that.
Yes, they will get behavioral health services and health services in general, as all correctional facilities are required to deliver. Yes.
I didn't know whether you had any connection with that facility, so it's good to know, and I'm sure other people have that question. So, other challenges? Can you think of any others that you're working toward solving, maybe?
Sure. Immunize Tuolumne County, which the Public Health Department is part of, is focusing on increasing our vaccination rate. By some measures, and it's a complicated measure because there's several little points where we look at, but by some measures we have one of the lowest rates of vaccination as a county in the state. Some of that is due to reporting issues, it's a complicated number, but focusing on making sure that our vaccination rate is high enough to protect the public and to protect vulnerable people who cannot be vaccinated for medical reasons.
So now we're going to touch on for just a moment the anti-vaxxers.
Okay.
Personally, I think people should vaccinate your children, but that's just my opinion. And I see it as a public health issue. I see it as, I have relatives who don't feel that way. They feel that's my decision for my child. One relative is considering moving out of the state because of the new state law. Can you, in a few words probably, explain why it's important to vaccinate your children if there is not a medical reason why they shouldn't be?
Sure. So vaccination has always been a public health issue. It's about preventing the transmission of disease to other people and to the vaccinated person. If you don't have a high enough rate of vaccination, you don't get the same protections that happen, what we call herd immunity, which is kind of a terrible term. But, there are people who cannot get vaccinated due to complicated health issues. And the only way those people can be protected from preventable diseases is through a high enough rate of vaccination. We know that these vaccinations have been the most effective thing that public health has done in the past century. We've drastically reduced the rate of diseases that killed large numbers of people. Polio, measles, smallpox. Hey guys, I have this wonderful book here called Smallpox Zero, which is the story of how vaccination completely eliminated a disease. And it's that powerful.
Yes, it is. And I'm highly in favor of vaccinating our children. There may be, in my mind, I don't have young children anymore, of course, but they are in the family. They may be able to work, I'm asking this as a question.
Okay.
Work with their doctors, their pediatrician, so that there are not so many at one time. That seems to be a problem with some people.
So some people do feel that way, and many doctors will accommodate that belief system. There is no scientific evidence that is needed. And in fact, there's a lot of scientific evidence that our current schedule is effective and appropriate.
Oh, good. Good to know that.
Yeah.
What about the autism specter out there that some people think is caused by all these vaccinations? Some component of the vaccination.
So there have been a long list of studies that have specifically disproven that. I like to think about it this way. The medical community has taken an oath to not harm patients and to work for the benefit of their health. And it wasn't as if that link was ignored. In fact, it was heavily studied because it would have been incredibly concerning if that link was true. And what we found was not only did that one physician blatantly falsify his data, and he is no longer a physician. He was stripped of his license. But we have multiple studies that now show that there is not a link. Now, that doesn't mean that we shouldn't be investigating the causes of autism. In fact, we still are. And
Yes,
I think that attention and awareness of developmental disorders is important. But that is not linked to autism.
Very good. That's a final answer for you folks who are watching. There are other, what do I want to say, objectives of the health department. Things that you do here. As I walked in this morning, I saw a gentleman, I have no idea what he was signing up for, but some service that you offer. I saw a sign for WIC. I saw a mommy with 2 little ones. Some of those things are done right here in the health department.
Yes.
Maybe you could inform us of what some of those things are.
Sure. So for those of you who don't know, WIC, W-I-C, Women, Infant, and Children, is a program from the federal government that provides nutrition education and sometimes provides supplemental food to women, infant, and children, and does a lot of health screenings along the way, making sure that children are gaining weight appropriately, growing and developing appropriately, making sure they get some required screening as well.
So it's a nutritional.
It's a nutritional program, yes, which is wonderful because the more nutrition education, the better. I like to think of chronic disease being related to 3 sort of branches: what we eat, how we move, and substance use. So eat healthier food, move more, don't use tobacco, alcohol, or other drugs, and generally you avoid the vast majority of chronic diseases or don't have them as severely.
I like that simple way you put it.
Yeah, so WIC is an important piece of that because they do a tremendous amount of nutrition education. We have another program called SNAP Ed. SNAP is the federal name for CalFresh. SNAP is Supplemental Nutrition Assistance Program.
I've seen wonderful ads lately.
Yeah,
On
good.
TV. They're eye-catching.
Yeah, so they also do really fantastic nutrition education, encouraging people to eat more fruits and veggies and move more. And really how to stretch your buck too. Like, how do you eat wonderful, nutritious, healthy food and not spend a ton of money?
Right.
So that's a wonderful part of our department. We also do some things more directly related to healthcare. So people who have certain disabilities might qualify for other programs we have, particularly children. And that's always been related to local health departments in the state for many years, since the beginning of the program, which started with polio victims. They had developed some significant disabilities, and health departments were charged with making sure that they were getting the care that they needed. That has sort of expanded through case management to more adults. We do a lot of work and outreach to make sure that people are aware of what resources are available to them and making sure that they sign up for the things that they might need and helping them with that.
And how do you do that outreach?
We do it in collaboration with anybody who will partner with us. So sometimes we go to our sister departments, whether it's the probation department or behavioral health or whoever, and try to reach the people that they interact with in general media campaigns or public education. I'm just trying to get the word
Now,
out.
I also know why you have been attending the YES Partnership,
Yes.
of which I am a member of.
Sure.
Very wonderful. That's a collaborative group. I think sometimes the people who have not heard of that group don't realize the different agencies that are represented there.
Yes.
Who network there.
Right.
So.
It's a great organization, and I think it's so wonderful to get all those organizations in the same room so that we're all aware of what we're doing and how we can collaborate. And the YES Partnership has been a wonderful collaboration partner for many topics that are of interest to public health.
For going on 30 years.
Yeah.
So anyone here in Tuolumne County who has not as yet heard of or knows anything about the YES Partnership, I'm going to put in a plug right now because it's a vital program here in the county that if you somebody wants to sell you a ticket for a fundraiser, be sure you respond.
Yeah, you could just simply Google Yes Partnership. They have a Facebook page as well that talks about a lot of their activities.
We have a very good web page.
Yes.
Also.
Yes.
So that can inform people.
Indeed.
What do you see now as you go forward, as you leave here this morning, and we leave? What do you see as your priorities?
Well, today happens to be a clinic day. We have a clinic here in this building, 20111 Cedar Road North, where we provide family planning services and screenings to many people. You can call our number 533-7401 to find out if you're eligible and to find out specifics. So we're making sure that some things are going on in clinic today, applying for a grant.
Is there a physician there?
There is a nurse practitioner there, and sometimes I'm there. Yeah, we do have medical providers there. Later on this morning, I'll keep applying for a grant. It takes a while to finish the applications regarding opioid safety. I've got a couple of meetings today, including the suicide prevention meeting later this afternoon. And just in general, trying to figure out how we can plan more chronic disease programming.
Well, that's a full day.
It's super fun, though.
Well, it's nice to know that you're enjoying it.
Yeah.
It's where your interest lies.
Indeed.
And we are beneficiaries of your skills that you bring to the job and your interests as you arrive here and work forward.
Well, thanks.
Is there anything else you want to have people know that I may very easily have missed?
I will just mention again that the County Health Fair is October 20th and 21st at the fairgrounds. You can get some relatively low-cost blood tests if you need them, other great health screenings, and you can get your flu shot.
Yes, and now how are we doing on time?
Still got 5 minutes if you want to fill it.
Well,
How'd you come to here?
How did I come here?
Yeah,
somebody talked about that.
a little bit.
A little bit. I was practicing as a primary care family medicine provider in Chicago, in underserved areas, and it was the dead of winter. No, I'm kidding. We
have winter here too.
We do.
We used to.
We used to. There used to be snow, yeah. I had obviously gone to residency in California and knew of how public health worked out here. Illinois, unfortunately, is having significant budget issues, and they're having a difficult time with providing their services. So there wasn't much of an opportunity for really working in public health there, and I really wanted to work in public health. And so I started just looking around, and somebody got a hold of my resume and said, you know, our health officer is retiring. And one thing led to another.
All these adjustments.
Yeah.
All these adjustments. As I said earlier, from big cities to a small rural community in the mountains yet.
Yeah.
That's their first time in the mountains.
Well,
San Diego, Chicago, Miami, no mountains.
First time in the gold country, outside of visiting Yosemite before. But I've lived in plenty of small towns. My father was in the military. I've moved around a lot. I'm generally kind of unfazed by that kind of adjustment. I really get quite excited about discovering new things, and I still just really like driving around, and I just think this area is so beautiful, and the hiking's great.
Oh,
so
it is.
Yeah, no complaints from me.
Absolutely. Well, again, we just have thoroughly enjoyed listening, and I've learned so much. I'm sure our viewers have too.
Kind of fun.
Thank you for sharing all this, and we wish you the best.
Well, thank you.
And the new position, relatively new position.
And thank you for taking the time to come here and talk to me. I'm delighted to talk about public health all the time.
Very good. Thank you.
Thank you,
Dr. Ortiz. And thank you, viewers, for chiming in and listening in. Sometimes I wish we were interactive. I may have missed some questions there or some information you may want to know, but you can always call those numbers or come by here and someone will inform you of the services that are available to you. Goodbye. This is Diane and Dr. Ortiz for Viewpoint.